Hi everyone, Dr. Ty here, and yes, I have a spine in my hand for one reason, because I'm a chiropractor, but most importantly, this spine is the window to your health. This is our essential number 2 training right here in the nerve system being free and clear of interference. Okay, so God put the most amazing healing power in that brain, and it needs to speak through the spinal cord to every single tissue, organ, cell in your body. The reason why that's important to know that it goes to all these other tissues, we already know that, but the breakdown of the nervous system is what most people don't know. 10% of the nervous system deals with pain. Okay, and we listen to that side more than anything else because we can't necessarily feel our function unless we're tired or something like that. But or if our heart just stops working, then we feel that. That's a bad day. So I want to point out that 90% of your nervous system is the functional part that can have problems going on without you even having a clue about that. So how do we keep that nerve system protected the right way? Well, that's where this comes in. God's designed us to have these beautiful curves forward in our neck. When we crawl, we have to lift our head up. That puts the neck curve in there. And then when we start sitting up and walking, that's when that low back curve comes in. And then as we get older, what do? We slouch and get rid of that. So that's the wrong thing to do. There's an ergonomics video that's going to help you out with that as well. So check that out. But for the meantime, we're going to look at this spine and see how we can maintain and keep that structure through spinal correction, and again, prevent any of those impingements of information or those interferences of information to where it needs to go. Okay? So first of all, again, our spine needs to have a good 45-degree curve in the neck forward and in the low back forward, and then a 45-degree curve in the mid back going backwards. This biomechanically is the most powerful structure that we can have to protect that spinal function itself, to protect the spine, and also to protect the nerve system. What happens through life is we learn to walk, and how do we learn to walk? We fall a bazillion times. That can cause these things called subluxations. We learn to ride a bike and we fall many times and crash, bang, boom. That creates these subluxations. Again, our kids, I'm talking about kids right now, at 5 years old, 1 year old, they're not running around screaming that they need to go to the chiropractor because their back hurts. There's just not the pain associated, because most pain that you're going to deal with comes from an inflammatory process. So if they fall and jam something, as soon as the inflammation goes away, which in kids it's going to go away real fast, there's no pain. That doesn't mean the misalignment or that subluxation isn't in there. That's the scary thing, because again, remember, 90% of this goes to your functional nerve system. Why are kids having so much asthma and allergies and ADD and ADHD these days, and ear infections? 2% of the kids, in the thousands of kids that I've treated over 20 years, less than 2% have had ear infections or have recurring ear infections. Whereas the statistics globally is, in America, it's 74% of kids have recurring ear infections. I mean, come on. Get the nerve system right, it can fix itself. That's what this is about. Is, as a chiropractor, I'm not fixing you. I'm teaching you how to fix yourself and letting the nerve system heal you, okay? So this 45-degree curve, if we lose it or if something gets out of alignment, that subluxation happens. That's a misalignment of the spinal bones that causes a compression on the nerve that leads to damage. It leads to miscommunication to wherever that's going to. And that can be right here in this upper back. Anyone ever had tension up here? Well, a lot of it is that flexed position. A lot of it because that is a fulcrum area for, boom, whiplash injuries, falls, work injuries, things like that. Now, this area of your spine protects the nerves that go to your heart. Okay, my personal situation, I had a curve that I damaged some ligaments in my lower neck when I was 18 years old and stuck a guy in football. I didn't know that I damaged any ligaments. I didn't know anything. It hurt a little bit, but it went away. I had a zinger that went down, electrical shock that went in my left hand. It went away. I felt fine, but what I'd started is a process like this, where the spine started curving out. By the time I was 30, my heart, even though I felt fine, my heart literally would stop beating for 4 seconds at a time. And it kept getting worse and worse until I finally found a chiropractor that said, this is the problem, and we need to use your muscles to facilitate the rehabilitation of that spine, to pull that curve out of there while we're adjusting you to, again, correct the spine. There's a difference between adjusting the spine and correcting the spine. We want to correct the spine. So guess what happened? At 30 years old, I corrected my spine, and my heart hasn't done that at all. And I'm 44 now, so that was 14 years ago. And that's why I take this system so seriously and making sure it's corrected. And that's why kids are so important to me, because I could have died. I mean, I literally would not be standing here had I not corrected my spine. How many people haven't had that ability and that chance? So this education needs to be spread out to as many people as possible so that they understand that the spine is the first place I look for my health. I look to make sure the spine is in great shape, and if my spine's not in great shape, then that means I could be susceptible to something else happening, an abdominal disorder, or, I mean, you name it, everything that the nervous system controls could be affected, okay? So how we correct that is we have to get x-rays of it. We have to see what that spine looks like. So if you haven't seen what your spine looks like, that's a problem. We need to know. From there, then we can go and see what's going on with your spine and what it's going to take to correct it. And that's what we do. We're great at correcting spines with your help through the home care. And yes, I mean, you're going to have homework when you come to this office, because that's what makes us so successful, is you partner with us, we correct that spine, and then we just maintain it after that. And we're going to maintain. I have patients that I've seen for 19 years now, as long as I've been in practice, because they come in not just to feel good, not just so things don't go backwards or anything like that. It's because they want to be at their highest functional potential and their highest functional level, and that's the first and most important way to do that. Okay, any other questions you have on the nerve system, feel free to email me. Feel free to get a hold of me at the office. I'm available to you anytime, and I love you guys, and I want the best for you. I want this country to just rise and function and stop treating the symptom side of things and start treating the actual cause. This is where it starts, right here. Okay, thanks for listening in. Be blessed and be a blessing.